Clinical rotation in radiology for 9th semester students of the Faculty of Medicine. The radiology clinical rotation in the 9th semester provides students with an in-depth understanding of the use of medical imaging techniques to diagnose various medical conditions. During this rotation, students are trained to understand the fundamental principles of radiology, select appropriate imaging modalities, and accurately interpret medical imaging results. The learning focus includes diagnostic radiology, such as X-ray, CT scan, MRI, and ultrasonography, and the application of imaging in specific clinical scenarios. 1. Objectives of the radiology rotation. Clinical competencies. Understand the fundamental principles of various imaging modalities, including their mechanisms, indications, and contraindications. Interpret imaging results such as X-rays, CT scans, MRIs, and ultrasounds. Determine the most suitable imaging modality based on the patient's clinical needs. Procedural competencies. Perform basic procedures, such as ultrasonography, under supervision. Contribute to simple interventional radiology procedures, such as imaging-guided fluid aspiration. Communication and collaboration. Communicate with clinical doctors to provide imaging recommendations based on indications. Coordinate with radiographers and radiology specialists to understand imaging processes. 2. Learning structure and daily activities. This rotation involves hands-on experiences in radiology units, imaging clinics, and interventional procedure rooms. Students also participate in imaging-based case discussions. A. Use of imaging modalities. Activities. Observe the production of X-rays, CT scans, MRIs, and ultrasounds. Learn standard imaging protocols based on the body area being examined. Assist in selecting the imaging modality based on clinical indications, such as ultrasonography for abdominal exams or CT scans for head trauma. Objective: understand the clinical applications and relevant techniques for diagnostic imaging. B. Image interpretation activities. Analyze chest X-rays to detect pneumonia, pleural effusion, or bone fractures. Interpret CT scan results for cases such as ischemic strokes, abscesses, or trauma. Read MRI results for neurological disorders such as brain tumors or disc herniation. Objective: develop systematic imaging interpretation skills. C. Interventional radiology procedures activities. Observe or assist in procedures such as cord-guided biopsies or ultrasound-guided fluid aspiration. Witness central venous catheter, CVC, placement using fluoroscopy guidance. Objective: introduce students to minimally invasive interventional aspects of radiology. D. Case discussions and imaging reviews activities. Discuss clinical cases with imaging-based approaches. Conduct radiological reviews with specialists to understand relevant findings. Objective: integrate imaging findings with diagnoses and treatment plans. 3. Imaging modalities covered: A. X-ray, conventional radiography, indications, bone fractures, pneumonia, pleural effusion, intestinal obstruction. Advantages: quick, inexpensive, and widely available. Limitations: not ideal for soft tissues or small lesions. B. Computed tomography, CT scan, indications, head trauma, strokes, cancers, intra-abdominal abscesses. Advantages: high resolution with the ability to view three-dimensional structures. Limitations: higher radiation exposure, contraindicated in pregnancy. C. Magnetic resonance imaging, MRI, indications. Brain lesions, tumors, disc herniation, or soft tissue abnormalities. Advantages: superior soft tissue detail, no radiation exposure. Limitations: longer examination time, high cost, and contraindicated in patients with metal implants. D. Ultrasonography, USG, indications, abdominal exams, gallstones, ascites, pregnancy, or thyroid evaluations. Advantages: non-invasive, radiation-free, and cost-effective. Limitations: operator-dependent and less effective for structures obscured by air or bone. E. Fluoroscopy indications, evaluate organ movement, such as the esophagus or intestines. Advantages: real-time imaging for interventional procedures. Limitations: repeated radiation exposure. 4. Diseases and conditions covered: A. Respiratory diseases, pneumonia, consolidation on chest X-rays, tuberculosis, cavitary lesions or infiltrates in the upper lung fields. B. Cardiovascular diseases, heart failure, cardiomegaly and pulmonary edema on chest X-rays. Aortic aneurysm, detection via CT scans. C. Abdominal diseases, cholelithiasis, abdominal ultrasound examination, intestinal obstruction, bowel dilation on X-ray or CT scans. D. Neurological diseases, stroke, CT scans for ischemia or hemorrhage. Brain tumors, lesions with contrast enhancement on MRI. E. Musculoskeletal diseases, fractures, diagnosed with X-rays. Bone infections, osteomyelitis, early detection using MRI. 5. Mastery of clinical procedures, basic procedures. Perform simple ultrasounds, such as abdominal exams. Understand basic protocols for CT and MRI scans. Advanced procedures, under supervision, assist in ultrasound or cord-guided biopsies. Conduct venography or arteriography with fluoroscopy guidance. 6. Learning methods. A. Direct observation. Follow imaging processes from preparation to result interpretation. B. Case discussions. Discuss cases integrating imaging results and clinical diagnoses. C. Clinical simulation. Practice interpreting imaging results using simulation software. D. Procedural participation. Assist in interventional radiology procedures under supervision. 7. Assessment. A. Daily evaluation. Assess students' abilities to select and analyze imaging modalities. B. OSCE. Simulation-based examination for scenarios like interpreting CT scans or X-rays. Circa logbook. Document clinical experiences in the use and interpretation of imaging. 8. Challenges and opportunities. Challenges. Difficulty interpreting complex imaging cases. Understanding different protocols for each imaging modality. Opportunities. Training provides insights into the application of modern radiology technology. Opportunities to engage in evolving interventional radiology procedures. Conclusion. The radiology clinical rotation trains students to effectively understand and utilize medical imaging techniques for disease diagnosis. By focusing on imaging interpretation and clinical applications, this rotation prepares students to integrate radiology findings into daily medical practice.